More on the story that we continue to follow. People lined up getting vaccines, and more Canadian children as young as 12 will be likely joining these lineups. The National Advisory Committee on Immunization is giving its approval now, okaying the Pfizer-BioNTech shot for 12 and up. So that keeps with the green light that Health Canada has already given, did so earlier this month. Provinces like Alberta, Manitoba, we've given you the litany today of provinces that have either already started to administer the shots, but are also planning to do so. Other provinces and territories going to be following suit in the very near future. And that is a starting point for our conversation today with Dr. Samir Gupta, as he does every Wednesday with us, a respirologist and an associate professor in the Department of Medicine at the University of Toronto. Good morning, Dr. Gupta.
Morning, Heather.
So we got that word from Dr. Tam yesterday, Canada's top doctor, that NACI is now fully recommending the Pfizer-BioNTech shot for those 12 and up. And as I was just mentioning, some provinces are already giving it. Others are set to come online. How significant do you think it is now that this is moving into this age group and further down?
It's significant in that that's about 15% of our population under 18. And we will need to engage with kids if we are going to get to herd immunity. I think it's also a sign of how well we've done with our vaccination campaign that we are at the point where many provinces are ready to now vaccinate kids and have started vaccinating kids. The information, even 2 weeks ago, we had approval from Health Canada, so it's not new. And in fact, the trial was finished at the end of March. It was a small trial, just over 2,000 kids. And it showed that it was very effective. In fact, none of the kids who got vaccinated got the virus. And the side effects were very similar to what you see in adults. A little bit of pain at the injection site, a little bit of fever, body aches, very reassuring. So onwards we go, and there's already a trial ongoing, which we should have information from maybe at the end of summer from Pfizer in 5 to 11. And Moderna has a trial ongoing now all the way down to 6 months of age. So we're getting the information that will enable us to expand this campaign.
Also hearing yesterday, we got a lot of new information yesterday sort of on where the vaccine and the vaccination program in Canada stands. NACI also still looking at the research that's available on mixing and matching doses. This is all, of course, surrounding the AstraZeneca situation. But Dr. Tam again saying yesterday that she expects people who got AstraZeneca will be able to choose their second vaccine. And there's a small study this morning, Dr. Gupta, out of Spain that looks at that very issue, that a Pfizer-BioNTech shot after AstraZeneca, according to this study, is safe and produces a stronger immune response than a second dose of AstraZeneca. So again, we come back, we've talked about this so many times, the mixing and matching, the choosing of the second dose. This seems to be something in the offing for Canadians.
Yeah, if we look at the study that came out, larger study that came out of the UK, the initial report was really looking at called reactogenicity, or what kinds of side effects people experience when they got a different shot for the second shot compared to getting two of the same. And people had more side effects, more sort of that feverish feeling, pain at the injection site, all of those things, which does suggest that probably they have a stronger immune response. And we'll know, in fact, the immunity data from that trial sometime in June, which sounds like we're getting smaller data sets from other trials suggesting the same. Those are good things. That is reassuring that the immunity would be higher. And we want to see that it's the right type of immunity and that the levels, if they are higher than getting two of the same shot, it would suggest that that would be an adequate strategy for us. A couple of things with the AstraZeneca. One is the concern about these blood clots, which are a rare complication and even less common in a second shot from what we have. Several million people have gotten a second shot, so even less common, but there are supply issues on that vaccine. So it's unclear if when people are due for their second shot, we'll have sufficient supply of it. So there are a couple of different reasons for us to be looking very closely at these mixing and matching data that are going to be coming out this summer.
I want to bring in a graphic that we have been showing this morning, Dr. Gupta. It's up from our CBC News tracker, and it shows the percentage of Canadians being vaccinated, and it also shows the supply of vaccine coming in and set to come online. Millions and millions of doses, 9 million in the month of June. Again, from the briefing yesterday, we heard some of the details about that. But if this continues, Dr. Gupta, Canada is actually going to out-vaccinate the United States very soon, sort of around now, midpoint of this week, in terms of the percentage of people vaccinated. Given where Canada started, what does that indicate of where we are now?
Yeah, it's been an amazing catch-up story in that we've had a phenomenal few weeks, even month, in terms of our distribution. What's really nice about those lines, Heather, is how close they get now, which means that we really are able to distribute most of the doses that we're getting. We're getting doses at a good clip as well, but we've figured out that last mile logistics, that distribution piece. We're at 46% of our population with at least one dose. The United States is at 47%. So as you said, we will surpass them. Of course, they have many more double vaccinated people because they haven't extended the duration between doses. But this is a great story. It really has shown how successful we've been across the country with our campaign, something for us to be very proud of.
Given, as you say, those lines, there are increasing calls to shorten the interval between the doses because there is more supply available, but also because, as I understand it, you want to have maximum immunity with the variants circulating as they are. And I'd like to end on that point because we're hearing out of Quebec, even as Quebec gives encouraging news and releases its reopening plan, it's put the variant that first emerged in India in a category that it says now is under high surveillance. And I'm wondering, again, what that signals and what we should be thinking of there.
Yeah, so we're learning more about this variant. The World Health Organization has now called it a variant of concern. It's in over 50 countries now. We've had it here for some time. What's important to recognize is that it has been in India since October. But for whatever reason, it wasn't until recently that it has really exploded and taken off. In most states in India, it is becoming the dominant strain, which tells us that it probably has some advantage with respect to transmission. If you look at it in a lab setting, there are 8 mutations in the spike protein. Some of those would be expected to increase its transmissibility. At least one of those would be expected to potentially reduce the protection that we have from this virus from vaccines. So certainly a concern, but we have studies now, an Indian study and a German study, showing that the neutralizing antibodies that we develop in response to vaccination do neutralize it, less so than the original strain, but above a threshold of other variants that we know that ultimately, clinically, people are protected through vaccination. So it's a generally good news from at least the lab studies suggesting that vaccination is likely to be protective against this variant. I think countries like India, where less than 10% of people have had a single shot, are potentially in trouble because of this variant and how fast it's growing. But hopefully countries like the UK, the US, now Canada, will face less of an issue because we have that good chunk of the population that is presumably protected from this variant.
That's interesting to hear you say that because from the UK just this week, they are, even as they reopen widely, they are very cautious about this variant as being something that could affect the schedule for further reopening. So sounds like Canada should not be complacent either on all of this. Thank you, Dr. Gupta, as always. See you next week.
See you. Take care.